from this briefing?
Well, Blaine, with South Africa's coronavirus cases confirmed now at the number 116, crossing that 100 mark, the Gauteng Premier David Makhura will brief the media here this morning on what plans the province plans to take to contain the spread of the coronavirus. You'd know that the largest number of confirmed cases are here in Gauteng. Speaking to the National Institute for Communicable Diseases a few moments ago, that number here in Gauteng stands at 61, and you would know that Gauteng has the biggest number of hospitals, referral hospitals, to deal with COVID-19. You have the Charlotte Maxeke Hospital, Steve Biko Hospital. Those are some of the hospitals that are going to deal with this particular pandemic. So with what we know currently and the latest figures that the Department of Health has issued, you're looking at those who've contracted the virus coming from places like the UK, from Italy, from Germany. So those are some of the high risk areas that President Cyril Ramaphosa had spoken about, and you know that the travel ban comes into effect today. So what we're expecting is that the Gauteng Premier David Makhura will tell us exactly what the plans for the province are. You'd also recall widespread in the media a Gauteng couple that also ran away after testing positive for the coronavirus. The province had to approach the courts in order to have them be taken to a place where they're able to receive care. So what happens in instances like that, Blaine? In instances where people do not want to be taken to quarantine or go and receive the necessary treatment, as in particular to this case that was widely reported. We need to hear from the Gauteng Premier what happens in instances like that. Should there be more stringent laws that will deal with those who are not willing to go and get tested or are not willing to go into quarantine? What were the circumstances, or what was the reasoning that was given by this couple for not wanting to go and get the necessary care? So critical questions that, of course, we would need to ask the Gauteng Premier, in particular, Blaine, also, because you would know that OR Tambo International Airport is here in Johannesburg. That falls under the Gauteng province. Now, that's the biggest airport in Africa. It is the gateway to the African continent as well as to the rest of the world in terms of population size as well. That is a very key factor that will play towards, the spread of the coronavirus, in asking questions about why such a high figure of 61 in Gauteng. So all of those questions will certainly pose to him, but critical in this instance where you have Gauteng with the highest number at 61, what the province itself plans to do about containing the spread of the coronavirus in the province.
So 61 in Gauteng, 116 nationwide. Talk to us, Chris, about testing. We know that the testing process has now been decentralized, which means that each province, as well as the private sector, can do these testing, but the ultimate verification has to be done at the National Health Laboratory Services, correct?
Well, that's right, Blaine. You would recall that the decentralization of the testing process is an issue that the Health Minister, Dr. Zweli Mkhize, had spoken about quite extensively, where ultimately, even though these tests would be conducted, some of them at these private laboratories, at the end of it all, the final verification process will obviously have to be with government's national laboratories, so that you don't get a situation like, for example, the instance that we saw in the Free State, where a private laboratory had tested positive for one of the patients, and at a later stage it was then subsequently found at the final verification point that it was actually negative. So that causes a lot of panic, and it was acknowledged by the health department that had indeed caused panic. So to ensure that you do have all the assistance, the private sector also coming on board to assist with this pandemic, but the final verification process itself will need to go through the National Health Laboratory Service in terms of government, so that there is one message that is being communicated, and also to eliminate a confusion about whether a case is negative or positive. So while all sectors certainly have been brought on board to come and assist with the pandemic, I think the decentralization is certainly welcomed, but how they've managed to structure it in terms of having a final point of verification is certainly very important.
Yeah, we can do without panic, Chriselda. Chriselda, the president, a short while ago was talking about panic buying and saying that, supply chain remains intact. So he's saying there's no need to stockpile at this stage. So he was just speaking a short while ago after this meeting with the political leaders. Chris, we're running out of time, but thank you very much indeed. We'll touch base with you at about midday or so to get an update with regards to what's happening to Gauteng. All right.